Artificial Intelligence Dr. www.abcpharma.net/English. User question. What is the life expectancy of a patient 70 years old with left bundle branch block and an Aveir VR leadless pacemaker with apical pacing? Gemini Advance. The life expectancy of a 70-year-old patient with left bundle branch block, LBB, and an Aveir VR leadless pacemaker with apical pacing is a complex issue and depends on several factors. Overall health status. The patient's overall health, including the presence of other comorbidities like heart failure, diabetes, or kidney disease, significantly impacts life expectancy. These conditions may independently affect survival and interact with the LBB and pacemaker. Severity of LBB. The degree of LBB and its impact on cardiac function, e.g., ejection fraction, can vary. More severe LBB with associated heart failure may have a greater impact on life expectancy compared to milder cases. Pacemaker function. The proper functioning and appropriate programming of the Aveir VR pacemaker are crucial. Optimal pacing can improve cardiac output and mitigate some of the negative effects of LBB, potentially enhancing survival. However, suboptimal pacing or device-related complications can negatively impact outcomes. Apical pacing can lead to ventricular dysynchrony, which may negatively impact cardiac function over time. This can potentially worsen heart failure symptoms and affect long-term outcomes. Individual variability. Life expectancy is also influenced by individual factors such as genetics, lifestyle choices, e.g., diet, exercise, and adherence to medical treatment. Research and data. There is limited long-term data specifically on Aveir VR leadless pacemakers in patients with LBB. Studies on leadless pacemakers in general have shown promising results regarding safety and efficacy, but their impact on long-term survival in specific patient populations is still under investigation. Estimation. Given the complexities involved, it's challenging to provide a precise life expectancy estimate for this specific scenario. However, we can draw some insights from existing data. General population. The average life expectancy for a 70-year-old in the United States is around 15–18 years. LBB impact. LBB itself can reduce life expectancy depending on its severity and associated conditions. Studies suggest it can shorten life expectancy by 1–3 years on average. Pacemaker impact. Pacemakers, in general, can improve survival in patients with bradycardia or heart failure. However, the specific impact of the Aveir VR leadless pacemaker on life expectancy in patients with LBB is still being studied. Consultation with a cardiologist. It's crucial for the patient to discuss their individual prognosis and life expectancy with their cardiologist. The cardiologist can provide a more personalized assessment based on the patient's specific medical history, the severity of their LBB, and the overall health status. They can also discuss potential treatment options and lifestyle modifications to optimize the patient's well-being and potentially extend their life expectancy.